بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is presenting some of the interesting cases in pediatric age group. Most of them are spot diagnosis. And this presentation will discuss some of the MSK cases. Here you see X-ray of the lower limb in a child with deformity and some resorption of the bone associated with pseudoarthrosis, and this is the classic for neurofibromatosis. Next case, this is a 11 years old child, post-traumatic fracture, and you see here post-traumatic fracture physical bar, and you see the epiphyseal plate here, it is open and here it is closed, and this will cause a growth and alignment abnormalities in the around the radius in this wrist X-ray. Next case, this is a 10 years old child with knee pain. As we see here, this is lateral knee joint X-ray. We see soft tissue swelling opposite the tibial tuberosity, and the tibial tuberosity associated with some fragmentation and little bit sclerosis. And also in clinical examination, there is tenderness over the tibial tuberosity. No history of trauma in this patient, and this is a classic for Osgood-Schlatter disease. Here, this is a 12 years old child. He has wrist pain after gymnast exercise, and we see there is some irregularity of the epiphyseal plane with some sclerosis, and we call it gymnast wrist, and this is Salter-Harris fracture type 1 of the distal radius. Next case, this is 1 year old child with foot deformity, and this is a classic for congenital club foot. Here we have elbow X-ray with a child, 7 years old girl with trauma. We have two things here. We have posterior elbow dislocation. You see the ulna and the radius are posteriorly dislocated in relation to the humerus, and we have also incidental supracondylar spare or process. Here we have X-ray of the left hip and including the upper femur, and this female 9 years old, and we see here the left femoral epiphysis is slipped, and we call it slipped capital femoral epiphysis. Here, this is a child with left hip pain, and we see the left hip femoral epiphysis is smaller than the right one, and it is increased in density compared to the right one and associated with some collapse and decrease in size compared to the right one and subcondylar fracture. And this is a vascular necrosis of the left femoral epiphysis, and we call it leg calf Berthes disease. Here, this is a child, a plain X-ray of the knee joint in AB position. We see a lesion involving the diaphysis of the femur, and the lesion, it is mainly lytic in origin and extended, seems to be extended outside the bone, and the zone of transition of this lesion, it is wide, means that it is ill-defined, and this indicate aggressive bone lesion. Malignancy is one of the differential diagnoses. Infection is another differential diagnosis. We ask for further evaluation, MRI for this patient, and here we have the T2 weighted images in the axial cut, and we see multiple fluid levels involving the described lesion. And the differential diagnosis of multiple fluid levels in a region, in a bony region, include aneurysmal bone cyst and telangiectatic osteosarcoma. And as we said that the region is aggressive in the blame film, so the telangiectatic osteosarcoma is most likely the diagnosis. And this type of osteosarcoma, telangiectatic type, is a rare type of osteosarcoma, usually accounts about 5 to 10% of osteosarcoma. And the survival rate is also similar to the conventional osteosarcoma. Here, X-ray of the shoulder X-ray, axial view, and we see anterior dislocation of the humerus in relation to the glenoid. And this also, you see also the glenoid, how it is impinging the posterolateral aspect of the humeral head, and this is, we call it Hill sac impaction fractures. And the, the, the dislocation resulted from anterior blow to the distal arm with arm in abduction and external rotation. So this is anterior dislocation of the humerus in relation to the glenoid. Here, this is an MRI of sagittal view T1 in a patient, child patient. As we see here, there is a low signal intensity in the distal femoral epiphysis. What is the diagnosis? Here, this is the coronal cut of the low signal of the AB of the knee, and this is again demonstrated the low signal intensity in the medial femoral condyle, and the lesion is consistent with osteochondritis dissecans and usually involve the lateral aspect of the medial femoral condyle, and this is one of the common location. Other common location in other bones, it is include elbow, and it is include the capitellum and also the talus. And the region here, it is still in contact with the bone. If it is losing the bone, and in the T2 we see a fluid signal surrounding the region, and this will become unstable and may be detached and resulting in a loose body. Here, this is a lateral knee joint X-ray. As we see here, fragmentation of the tuberosity of the tibia associated with soft tissue swelling, and these findings are characteristic of Osgood-Schlatter disease. And on examination, there is tenderness over the tibial tuberosity. Here, this is a wrist X-ray BA view in a child. As we see here, there is patient has trauma on overstretched hand, and we see here there is a fracture line involving the scaphoid. This is the scaphoid bone, and this is the lunate bone, and this is the fracture line. This is a fracture scaphoid. Here, another case, elbow X-ray, we see lateral view of the elbow. As we see here, this is the ulna, and this is the radius, and this is the olecranon apophysis, and we see here the radius and the ulna are fused together, and this is a congenital fusion of the radio ulna. Next case, this is a hand X-ray of a child. As we see here, there is absence of the thumb in this patient, and also absent of the radius. And there is a spectrum of anomalies, including that absent of the radius and some of the carpal bones and the thumb. And this is associated with Vactier, VACTERL, and also associated with Holt-Oram syndrome, associated with Fanconi anemia, also associated with thrombocytopenia absent radius. These are the differential diagnoses. Here, this is 2 years old female, post-trauma, and this is A-B view. As we see here, there is soft tissue swelling on the radial part, and there is also a fracture line involving the lateral condyle of the humerus femoral metaphysis, and this is Salter-Harris type 4. Here, this is the X-ray of the shoulder, and this is showing anterior dislocation of the humeral head displaced inferiorly and anteriorly in relation to the glenoid. And how we see it is how impinging of the glenoid on the posterolateral aspect of the humeral head, indicating the Hill-Sachs deformity. Here, this is sagittal view T1 weighted imaging of the ankle, and the patient has pain in the ankle bone, and we see here this is the calcaneus, and this is the navicular bone, and this is the talus, and we see low signal intensity of the anterior bosses of the talus. This is the talus. This is the talus, and the anterior bosses of the talus adjacent to the navicular bone and calcaneum, and this is the low signal intensity, and this is the called fibrocartilaginous calcaneo-navicular coalition. And the tarsal coalition suggests on the lateral foot X-ray, and we see elongated calcaneal anterior bosses. This is the anterior bosses of the calcaneum, and it is best seen in the oblique view. So this is calcaneo-navicular fibrocartilaginous coalition causing pain, and this is the low signal intensity here. Here, this is a wrist X-ray in a child patient. As we see here, the ulna is longer than the radius, and we call it this is ulna plus or positive variance. The ulna should be the same. Normally, the ulna and the radius should be the same, but here the patient has trauma, as we see in the first case in the patient, and we see here epiphyseal bar on the radius causing alignment and disturbance on the growth. Ulna plus variance, this means the ulna is longer than the radius, can cause injury to the fibrocartilaginous complex and impaction of the lunate bone. And we see here the ulnar styloid is fragmented. This is a radiograph of the hand in a child. As we see here, this is the first, second, third metacarpal bone, and the fourth and the fifth metacarpal bone are short comparing to the other metacarpal bones, and this is typical of Turner syndrome. And patient also have usually short and have a broad neck. Thank you for listening. Hoping to see you soon in another talk.